I want to make it very clear. The Republicans are asking for negotiations on the debt ceiling process to add some fiscal restraint into the debt ceiling extension. And I ask you, Secretary Becerra, to take back to the President my plea that he engage with us in negotiations. I want to make it clear. We are not talking about trying to reduce benefits in Medicare or Social Security for our seniors. What we are talking about is reasonable reforms that can help us get to some kind of fiscal restraint on our spiraling debt. And I just encourage all of my colleagues in the Senate, but particularly the President, to engage with us in those kinds of negotiations. I want to start my formal remarks on the positive. You've testified before and have talked to me privately about the fact that although we have our differences on a lot of different policy areas, we want to find those areas where we can work together, and we've found some last year. Last year, as Senator Wyden has already indicated, we came together on a package of bipartisan reforms to produce common sense solutions, ranging from mental health improvements to comprehensive telehealth coverage for seniors and working families. Moreover, we accomplished all of this by reducing the deficit by billions of dollars. And the administration and you, Secretary Becerra, worked with us on this, and we've made good progress. I look forward to partnering with HHS as well as with my colleagues on both sides of the aisle to advance further reforms like this in this Congress to improve health care access, affordability, and choice for all Americans. That being said, I do have concerns with the budget that the President has put forward. Unfortunately, many of the proposals in the President's budget run directly counter to these types of initiatives that I've discussed. I have serious concerns with the focus on partisan policies that risk harming health care access and affordability for both current and future patients. We talked about some of this yesterday. The budget's central proposal, for instance, would dramatically expand the size and scope of the bureaucratic government-run drug pricing program enacted last year in the IRA. Prior to that law's passage, my Republican colleagues and I warned repeatedly that imposing sweeping price controls would prove disastrous for patients, biomedical research and development, and domestic manufacturing jobs. And many of our fears have already come to pass.
Good evening, friends. Happy Thursday to all of you. New relief measures are now being passed. Multiple cities and states across the U.S. are guaranteeing low-income households automatic recurring checks. How much these households will receive will be based on their income. Friends, today I'll be going over a new updated list of states and cities with relief payments, so please make sure that you watch until the end of this video. Also, tomorrow, I will be announcing more winners for the Walmart gift card giveaway. If you'd like to enter the giveaway, friends, all you have to do is click and like several of my videos, and then comment below the keyword of each video that you watch. The more videos that you comment on, friends, the greater your chances of winning the weekly giveaways. Even as U.S. inflation moderates for millions of Americans, every trip to the grocery store is a pain in the pocketbook. Supermarket prices have increased at the fastest rate in decades, putting staples like eggs, bread, and meat out of reach for many Americans. Over the past 2 years, egg prices have doubled, leading some consumers to extreme workarounds to save on household funds. Meat, fish, and chicken are all substantially pricier than they were 2 years ago, as well as cereal, bread, and pasta, which cost nearly 25% more today than they did in 2021. This has led to states to approve new relief measures. Low-income individuals and families are receiving up to $1,000 per month from dozens of cities and counties under the Universal Basic Income programs that are spreading around the United States. This is thanks in part to the billions of dollars provided in the 2021 American Rescue Plan. Chicago, Illinois is in the midst of an effort to give 5,000 residents at least $500 a month from a $31.5 million surplus of money called the Resilient Communities Pilot Program. Neighboring counties are offering another $500 a month to another 3,250 residents from a $42 million fund. So while some of these programs are funded through Biden's federal legislation, Illinois Board of Commissioners said the plan is to keep the county-level universal basic income program in place even after the federal funds run out. The National Association of Counties have met in Washington, D.C., and discussed future county-level basic income programs. Residents in Prince George County, Maryland, can look forward to potentially partaking in a new universal basic income program that will provide recipients with cash payments every month. The program will provide monthly payments to low-income families to support their basic needs, including paying for groceries and utilities, and allow them to spend the money in any way they see fit. In total, the program would last 24 months, or 2 years. State leaders said the payments would range between $500 and $800 per month, and around 200 people would be chosen as recipients. Will be modeled after California's Stockton program, which distributed payments of $500 each month to recipients. Washington Times reported last year that Los Angeles is mostly self-funding a $1,000 per month universal basic income program. The state also said that Oakland is providing some low-income families $600 a month for at least 18 months, and San Diego is giving low-income families with children $500 a month for 2 years. So, dearest friends, what are your thoughts about universal basic income programs? Please let me know what your thoughts are in the comment section below. The U.S. government wastes billions of taxpayer dollars every year. According to the Government Accountability Office, improper payments, which refer to payments that are made incorrectly by the government, cost the United States $247 billion in 2022. The United States government has lost almost $2.4 trillion in simple payment errors over the last 2 decades. Another $32.7 billion in unknown payments were also recorded, meaning it's unclear whether the payment was an error or not. Finally, there were $9 billion in technical payment errors, meaning a recipient was entitled to a payment, but the payment failed to adhere to rules or regulations. Payment errors were reported by 18 agencies across 82 government programs. The vast majority of these errors were made under 5 programs: Medicaid, Medicare, the Paycheck Protection Program, unemployment insurance, and the Earned Income Tax Credit. The Government Accountability Office recommends better monitoring and planning by the federal agencies to help identify risks for payment errors, and that the IRS review more W-2s before issuing tax refunds to lower the risk of tax refund fraud. So the Government Accountability Office is not the only entity to report on billions of dollars of federal waste. Well, my beautiful and most magnificent friends, that is the end of my daily stimulus update video for this Thursday. Thank you, dear friends, for joining me here and for being part of this community. To say thank you and to show my appreciation, I will be announcing more winners tomorrow for the $75 Walmart gift card giveaway. If you'd like to enter these weekly giveaways, all you have to do, friends, is click and like several of my videos, and then comment below the keyword of each video that you watch. The more videos that you comment on, friends, the greater your chances of winning the giveaways. Thank you and have a wonderful and very blessed week.